Good afternoon, everyone. Thank you for joining us for today's really important topic, the road to wellness, mental health resources for military families. I could not think of a more perfect month for us to bring this topic to our listeners when it's Suicide Prevention Awareness Month here in September. So thank you for taking a moment out of your day to really talk about mental health and the importance of mental health for our military families. We could not have this conversation without experts in the field to join us. So I want to take a minute to start with some introductions with our friends from the American Red Cross, and more specifically in the Military and Veteran Caregiver Network at the American Red Cross. And I'm going to give each of them a moment to introduce themselves, what they do at the Red Cross, so that we can get this conversation started. So why don't we go ahead and start with you, Melissa, and then we'll turn it over to Rachel.
Thank you so much. I'm so honored to be here. I'm very grateful to be the director of the Military and Veteran Caregiver Network at the American Red Cross, but probably I'm more grateful to be the caregiver for my husband, who's a combat wounded Marine. And I'm here just to share my experiences, talk a little bit about some mental health resources, and hopefully help people find the support they need.
Thanks for having me. I am Rachel Moyers, and I am also a caregiver for my husband, who was in the Air Force. And I run our outreach and engagement at the Military and Veteran Caregiver Network. And I am so happy to join you guys today.
I love it. Let's dig in. We promise our listeners we're going to keep these conversations short and sweet to just introduce them to the resources. So for those of you who are tuning in for the first time, don't feel like you have to frantically take notes. This is a conversation, and in the coming weeks, we'll get everything posted on our website so that you can refer back to any of the resources that we mentioned today. So why does this even matter? You know, for those of you who don't know us at the Military Family Advisory Network, we do research every 2 years on what's impacting military families. And we learned most recently in our survey that was just released in July that over 46% of military families have accessed mental health care for either themselves or their families in the last 2 years. That's a pretty staggering number. And we didn't hear that all of them were able to access everything that they wanted. So today we really want to highlight some of those resources that are available. So let's start with active duty. So Melissa, Rachel, if one of you could jump in and get us started with, if I'm on active duty and I'm struggling or someone in my family is struggling, what are some of those resources out there we can turn to for help?
So I'll take that one. I have my top 3. And at the top of that is TRICARE. You can reach out to your TRICARE beneficiary support. You can look, find providers, do a zip code search, and you do not need a referral. I think there's a lot of misunderstanding that you need to go to your primary care manager first and get that referral for mental health. You do not. You can search right there on the TRICARE website. You'll pick your region, you'll pick your beneficiary, you'll pick the TRICARE version that you're using, and then you can search for in-network providers that can get you help with mental health appointments. My second favorite is Military OneSource. I myself have used Military OneSource. When my husband was first injured, I called Military OneSource because I needed help with a provider that would understand our military experience. And I was quickly connected and quickly got an appointment to see a provider out in the community. So very fortunate to have the support of Military OneSource when you are active duty, and I strongly encourage you to take advantage of that. And then our MFLACs, our military family life counselors, or the chaplains are my other go-to. They're available right on the installations. They're professionals. They can help with some of that moral injury, your spiritual care. Really great resource that's available on installations.
Melissa, I love that you highlighted those first 3, but can we put a fine point on something that you just said that is news to even me? I always thought that your primary care physician had to refer you if you were under TRICARE to go get mental health help. So what I just heard you say is you do not need a referral. So I just want to echo that, put a fine point on it, and make sure I heard that right.
Definitely. Sometimes it's really hard to ask for this type of help, and the quicker you can get to that provider, the better. And I think TRICARE has recognized that. And so you now can search. You can search by psychologists, psychiatrists, different counselors, different areas of mental health needs for families, for marriage. And all of that can lead you right to the person that you will hopefully have a good relationship with and can help you with some of your mental health.
That's incredible. Now, does that apply to both the dependent and the service member? Not having to get a referral? Do you know the answer to that?
I believe they've moved mountains to remove barriers for anyone seeking mental health support, but I don't have that answer for sure. There are
Fantastic.
options. If you are uncomfortable going to command as a veteran, as an active duty service member, there are also community options that you can go to. So, things like Give an Hour. Give an Hour is a wonderful network of psychologists and counselors, therapists really out there that want to give that hour, that mental health support to our military and veteran families, their caregivers, and veterans themselves. So even if you are concerned about going through TRICARE or having your command know about your mental health, there are community options that might make it a little easier for you.
Great resources. Rachel, I want to turn it over to you a little bit to see if there's any other resources you would tack on to what Melissa just shared, but then maybe also help us transition to, since you're the Outreach and Engagement Associate for the Veteran Caregiver Network, kind of where can our veterans go for this support?
So I love all the ones that Melissa highlighted, and I really am happy that she went into the Give an Hour so that we can step into some of those nonprofit organizations that have really stepped up to establish help for both our active duty, but also our veterans. So there's a lot of support that can go through in finding, because when we move over to and transition to that veteran space, sometimes we don't have access to TRICARE anymore. Sometimes we don't have insurance that just automatically comes with everything we do, and it takes on a lot of effort to be able to do that. So still, if you do have access to TRICARE, looking into finding some of that outpatient, some mental health support, going through your PCM is one way to start, but I do like that Melissa has highlighted that you can go without the referral, because that is an amazing step to reduce that barrier. And then reaching out to nonprofits that are there to help support us, just finding someone who is there willing to listen to you and say, okay, I need a little bit of help, and they navigate you and they know what different options you have. Give an Hour is still available for on our veteran side. So that's really great to have that also.
So you both have brought up some great resources, but I want to talk a little bit, if you have any recommendations, anecdotal or otherwise, from your own experience, from what you're hearing in your network. Our data recently outlined for us some of the obstacles that families face when trying to access mental health care. And unfortunately, the data we collected in 2019 and the data we collected in 2021 kind of had the same top 5. So I'm going to lay them out here for you guys, and I'd love to hear your opinions or even just advice for anyone listening who's facing one of these obstacles. Anything you can help them, understand to navigate these kind of obstacles. So one is kind of lack of available providers and appointments. That's come up in both of our most recent surveys. One, just a general kind of consensus about quality of care not being at the level they would like it to be, rating it as far as poor, really. Negative experiences with TRICARE, unfortunately, stigma and career implications, which I know we're going to dig into that one for sure. And then just lack of specialized care. So those 5 obstacles have come up twice now in our last 2 most recent surveys, and would love for both of you to pick your favorite of those top 5 or share any of your tips on kind of, yes, it's an obstacle, but here's some ways you can navigate that.
So I'll jump in on this one because we hear that a lot as well, that they can't find a provider. And this is for our active duty members as well as our veteran members. Unfortunately, the pandemic really did exacerbate our mental health providers across all, military and civilian together. So there is an issue with a lack of providers. For the poor experience, I hear you. I know how hard it can be when you make an appointment, you go, they're late, they don't know anything about the military, they don't understand, what it took for you to actually get to the appointment. And the care is, very inconsistent. Maybe they're canceling on you. That's very, very hard. Where I have seen success is in telehealth. So I myself have had to use telehealth because of the pandemic, and I was very hesitant at first. I was like, no, this is a medical situation. I feel like I really need to be seen. And I really benefited from the telehealth. I really felt it helped me. I felt all of those issues with, driving to the provider, waiting in the waiting room, having them be late. All of that was eliminated. It was very straightforward. Now I'm very comfortable with technology, and sometimes that's a barrier for people. So if it is, you can also work with these providers. You can learn in peer support groups about how to access online forums. It really does help you with your confidence in participating in telehealth. And then I do have to give a shout out to the Cohen Clinic because I saw that on the last slide. Cohen Clinic is my gold star rated provider. We had to utilize mental health for my son during the pandemic. And because they were so culturally competent on the military, veterans, and then caregiving homes, we really had an excellent experience. And they were, to the point of being life-saving for our son. So very, very grateful for the Cohen Clinic. And they do have, they keep growing and building. They have a clinic right now on Camp Pendleton, which I think is really exciting. So just looking at those resources and not being afraid of the technology and the telehealth, I think can cut through some of the challenges people are having.
I love that you mentioned peer-to-peer support because that's something we haven't brought up yet, is so crucial. And then telehealth, thank you for bringing that up because I think, Melissa, a lot of us are in that same boat where that kind of uncomfortableness of like, but I need to be sitting there to have this conversation and kind of pushing through that and realizing there's this amazing service available to you if and when you're ready and have the technological skills and savviness, which hopefully we're all getting a little bit better at as we sit here on Zoom again. But thank you for sharing the peer-to-peer and Cohen. They're an incredible partner in this work, and I'm really glad that we're able to give them a shout out today. Rachel, I don't know if you have anything else you want to add, but I would love to hear anything you can share for our listeners on how we help to eliminate the stigma about accessing mental health care.
I think in all honesty, it's a transparency piece. So you can sit there and you can have a conversation, whether you're talking to a provider, whether you're talking to a peer, and if you're going to have trouble, I'm struggling with this. And it can be as simple as, I don't know the buttons on Zoom and I don't know the best way to do it. Or, my civilian provider has an app that I have to download to be able to use my telehealth. And if I wasn't prepared but they told me, hey, I need you to download this. This is how we'll access it. It'll come through secure calendar invite. Same thing, the VA resources do that. We use a lot of VA resources, telehealth, and it really kind of reduces some of those stresses of going into the facility. While being able to navigate it, and I can be there to support my veteran, or if there's somebody else that needs extra support, here, let me show you, we'll do it right here, and then you go and have your appointment and I will leave the room. So I think that helps reduce those barriers, just talking about it. It reduces the stigma. The more we make this normal conversation, the more we say, hey, I struggled here, but I celebrate this. I now get on Zoom and I know where all those buttons on. Let me show you what I'm doing, is just going to help us all continue to move forward.
I absolutely just wrote down struggle here, but celebrate this. I think that's such a great perspective, Rachel. Every time I have a conversation with you, you give a little nugget that I write down in my notebook, and it's so powerful. And I think you're absolutely right. So, we all struggle. We also can celebrate the little victories, but just being a network to support each other and making this conversation the norm, I hope will help eliminate some of the stigma and let folks feel comfortable reaching out to the plethora of resources you both have shared today already. I want to take a minute to maybe talk about something that's a little harder in terms of I'm in a crisis right now. Myself, a loved one, I'm experiencing a mental health crisis. Where do I go for help? What do I do if I need help now?
I think jumping in and calling 988 now, especially since that has changed, and the number, we don't have to remember all the different components that go into that. You can just dial 988 and then dial 1 for the veterans part of it all, depending on that. But it's an easy, accessible, we've got 3 numbers. We all remember 911. We have that as an access as well. And going to the emergency room and again, saying this is the issue, you are able to do that, and having a facility that's right there to get you to a safe space, and making sure that your loved one and you have the support underneath you to be able to navigate that crisis.
Let's put a fine point on that, 988. That number was just released. Goodness, it feels like yesterday, but I know it was a couple months ago now. So the summer is flying by, but 988, to your point, Rachel, we've all memorized 911 since we were a little kid. Let's normalize that if you need help with your mental health and you need it now, let's call 988 and try to get you connected. So it's a great resource. We promise our listeners we keep these kind of short, to the point, and bite-sized. So I really want to kind of get towards the end of our conversation with a question to both of you, and you can volunteer who wants to answer first, but this is for both of our panelists today, is if there's a listener right now watching this who's struggling, who doesn't still know where to turn to help, is maybe struggling with taking the step to ask for help for whatever reason is holding them back, what one piece of information would you want them to walk away with today, based on your experience in kind of working in this field?
So to anyone who finds themselves in that situation where you know you need help, good for you. First of all, you have amazing self-awareness. Sometimes these mental health things creep up. Sometimes they come as a crisis right away. But the fact that you're noticing now and that you have these resources available to you, whether it's TRICARE or the Veterans Administration or Given Hour, Cohen's Clinic, you now have been given some tools where you can go and leverage the resources there. I also really strongly encourage you to get involved with your peers. There's a military spouse, there's another caregiver, there's a survivor that knows things that can be helpful to you. And so engaging in these peer relationships, peer networks, peer support can really help you understand that, one, you're not alone, and they're usually a wealth of really good local information. So you're not alone. Good for you for recognizing that you need some help. And please, please use the tools that we've shared today.
You are not alone. I'm writing that one down too, Melissa. So Rachel, I'm going to turn that same question over to you.
Well, it's hard to follow Melissa because she put it all together in a beautiful bundle. And mine is that peer support, going to someone and being transparent. And it can be small, it can be in the group. Just, I need to know the next right step, and I need someone maybe to take it with me. And you can do that through peer mentors. You can do that just in the groups alone, but going with the intention. You've recognized that you need the support. I'm going to have an intention moving forward that I want to find support to help me. So going in there with that will help reduce some of that overwhelm when you have all these different competing obligations and consequences and moments of just worry and fear and stigma, all the things that go with it. Having that supportive people behind you to help lift you up, help continue to move forward, even if you just have to sit in the space together for a little bit. That's where it would be my go-to start.
I knew when we started this conversation, I could sit here and talk to the two of you for hours because you're so passionate, you're so knowledgeable, and you deeply care about our military and veteran families. And so I just want to say thank you to both of you for, one, sharing your stories and how personal this is to you, but also making sure our listeners know where they can get help. Truly, truly appreciate you both. With that said, I want to make sure that we're respectful of our listeners' time. This is a heavy topic, and we want to make sure that you know the resources that are available to you so that you know you're not alone, you know where to find those peers. So stay connected. Follow us at mfan.org, follow our social media. Like I said at the beginning, we will post a recording of this webinar along with the slides and additional resources on our website so that if you miss this or you want to share it, because this is a great amount of information to share with your network, you can do so. And most importantly, these virtual webinars are for you. We want to make sure we're connecting you to those resources you feel you need for your family. So please take a minute to fill out our survey at milfanet.org/mhresources. We read every single response that comes through those. And so please, please, please take the time to fill it out and tell us, one, not only what was missing from today, what else can we share with you? And we'll get that out to you. But two, and more importantly, what do you want to hear next? So I want to again thank Melissa and Rachel for all the work they're doing across the Military and Veteran Caregiver Network, and our partners at the American Red Cross for the work that you're doing in this space. It's so, so important. And again, tune in next time, and we really appreciate our listeners. Be safe, be well, and we'll see you next time.